Good afternoon, live from the GDHF Watch Party in Abuja, Nigeria. I'm Otse Ogorry with Health Strategy and Delivery Foundation. I'm here with my colleague Otse from Palladium.
Hi.
Welcome, Otse.
Thank you so much.
Great to have you here, and thank you for co-hosting this event. Excited to be here with you. Can you tell us a little bit about what your experience has been with the Digital Watch Party?
I think it's been great so far. I think looking at the fact that for folks that are unable to travel to DC, able to participate in the event is actually really exciting to me. And also having key stakeholders and players in the digital health space in Nigeria come together to discuss about our common issues, our common challenges, and trying to see how we can actually profile common solutions. I think it's a great one. And thanks to GDHF for bringing this to Nigeria. I think it's a good one. We should have more of it.
Absolutely. So we're looking forward to this next year. So Otse, can you tell us about an interesting digital health innovation that Palladium, who's a forerunner in the not-for-profit sector, has supported to deploy across Nigeria?
Well, that would be a tough one for me, but maybe I'll just pick one. So currently, I lead the Data for Implementation project, or Data.FI, and Data.FI currently supports a digital health product for USAID. USAID is funding us to do this in Nigeria. So currently, we support an electronic health record. We've deployed this health record in over 600 health facilities. And it's being used primarily now for the HIV/AIDS program. It also has capabilities to be expanded to other disease areas. In fact, we are currently discussing with stakeholders in country to see how we can expand the LAMISPlus to other disease areas. So it's actually one of the key products that we are supporting for USAID, considering the fact that it's able to help USAID better measure their program performance, help the government of Nigeria see better patient outcomes. And this is a tool that speaks to one of the agenda of the Honorable Minister of Health, looking at better health outcomes for Nigerians. So with this digital solution, we are very optimistic that we'll be able to do this to support the agenda of the Honorable Minister. So it has a couple of modules. There are modules that looks at COVID. I know we just got off the face of COVID. There are modules that also speak to other areas of the HIV/AIDS program, and it's really exciting to me because it's a homemade digital tool. It was developed by Nigerians for Nigeria, looking at the context of our healthcare system and tailored to actually address our problems and the context of the Nigerian healthcare system. The interesting thing, however, is this tool is able to be scaled up to other countries because it has the potential to be scaled up to other countries because it's currently developed in a modular format. And what that means is that it has a core and there's a plug and play. So you can develop modules specific to disease areas. You just plug it to the core and then you run with it. So it has that functionality and it's easy to be adapted or adaptable to other settings and also easy to scale it up. So I think it's really exciting to me to talk about LAMISPlus. I can go on and
definitely. LAMISPlus seems like a solution that's on point with everything we've talked about today. We've talked about localization.
Right.
We've talked about sort of expanding beyond sort of a country focus to regional expansion and, really gotten the lens across the different sectors. So what can we look forward to next from Palladium in the area of digital health?
So right now we are currently discussing with different entities in the health sector. So we're talking with NCDC. We are working with the Federal Ministry of Health just to see where Palladium can better help them optimize the current systems that they are currently supporting. So for example, we're working with NCDC to optimize the SOMAS. The SOMAS, everybody, I think most people knew about the SOMAS during the COVID outbreak, but there have been some enhancement challenges with the SOMAS. So the SOMAS is a digital tool used by NCDC, the Nigerian Center for Disease Control, to provide surveillance to provide surveillance in all their disease-supported areas. Palladium is working with them under the Data.FI project, working with NCDC to enhance this tool. And I think it's something exciting that I think you should look out for in the next couple of weeks. We should have something that will present to the nation about what we have done with the government of Nigeria.
Exciting. Thank you so much, Otse.
Thank you.
Looking forward to those big initiatives you're driving in the digital.
I'll keep you posted. Thank you so much.